Hi, my name is Chowdy, and I am proposing my project for improving medication adherence. This is to enhance patient outcomes in behavioral health patients and implementing um, a roadmap for personalized support program for these behavioral health clients. Now, medication adherence refers to whether a patient takes their medication as prescribed, including the correct dose, at the right time, and for the appropriate duration. It's a crucial component in managing and treating various health conditions, especially in behavioral health. Now, in the US alone, it's estimated that medication non-adherence leads to approximately 125,000 deaths annually and costs the healthcare system between $100 billion to $289 billion. Now, our project doesn't just aim to improve those numbers, it seeks to help save lives and reduce unnecessary spending by leveraging the power of business analytics and patient-centered technologies. So, a study published in the Journal of Clinical Psychiatry found that non-adherence among patients with behavioral health issues can increase the risk of relapse and hospitalization up to 50%. This not only affects the well-being of individuals, but also strains our healthcare facilities and our resources. Now, we have about 4 project objectives to enhance medication adherence. We aim to improve the percentage of behavioral health patients taking their medication as prescribed by 25% within the first year. We want to enhance patient involvement in their treatment plans through education, through counseling, and the use of digital health tools. We want our score to be about 80% above in the engagement score. We want to reduce healthcare costs and decrease overall associated costs associated with poor adherence, such as hospitalization, readmission, and emergency ER care. And we want to reduce the readmission rate due to medication non-adherence by 15%. We also want to utilize analytics and patient data to inform and adjust the patient treatment plans, aiming for personalized care. Now, we have a few key performance indicators that we will be utilizing. The medication adherence rate, we will be utilizing patient self-reported reports. And we also be utilizing pharmacy refill data and also digital tracking tools. Some of the methods of engagement indicators for the patient engagement score would be the rates in which they're engaged with the education programs, the feedback scores on the patient surveys, and also the adherence to the apps and the platform. Regarding the hospital readmission rate, we want to reduce it by 15% in regards to the medication not adherence patients. And then we would utilize the hospital records as well as our patient tracking system. So our strategy and implementation for our project, we will be utilizing several things. One of the main things is implementing our patient app that provides patients with medication reminders, helps them track self-reported adherence, and also enables the providers visibility into the compliance of the patients and the challenges that they might have. We want to also design tiered intervention pathways that accounts for barriers like health literacy with the patients as well as unstable housing. We also want to offer one-on-one counseling for higher-risk groups, along with group education and online resources that will be available for the patients as well. For our provider training, we want to equip clinicians on the best patient communication practices and the use of adherence dashboard to collaborate with the care team across the different various gaps for the patient. We also want to make sure our stakeholders are collaborating effectively. Our pharmacists would assist with the complex medication regimens that our patients would have challenges with. Community health workers would be engaged with providing support services and resources, and their care providers as well as caregivers would help track their progress. The training curriculum for our clinicians and patients would equip clinicians to leverage the new technology, data, and communication pathways to best collaborate with their patients. And the workshop for the clients would explain tracking tool purposes, sharing best practices on medication habits, as well as offering additional services. So for the staff, they would have to understand the system functionality, interpreting adherence data, and communicating strategies. And that would be an 8-hour online self-paced course that they would take. For the patient workshop, it'll be a 1-hour in-person workshop. It'll educate them on the importance of medication adherence, as well as using the tracking technology and showing them their offering and ongoing support resources. So our project impacts that we expect is, to track and validate project effectiveness and guiding our future improvements. And so we would do this by identifying the root causes that for our targeted solutions, such for example, medication complexities that patients would face, the side effects that they would encounter, the lack of external support, forgetfulness and limited routine, low health literacy, and their fragmented care team that they're not aware of. And so our ultimate aim is to deliver improved patient health outcomes, reduce healthcare costs, increase patient engagement and satisfaction, as well as data-driven healthcare decisions. Our budget funds would be a total of $47,000, and which would include $30,000, which is the main bulk, would go to technology implementation. So it would be the Adherence app purchase as well as integrating with the clinical system. $10,000 would go towards the patient support program, education workshop, curriculum development, as well as materials that'll go along with the staff and the patient. $5,000 will go towards provider training for clinical e-learning module creation, as well as the backfill for the staff coverage. And lastly, the last bit would go towards the data analysis and reporting. So statistical analysis, the IT department would utilize this, this budget. So for our project roadmap projection, so this gradual rollout allows for the initial change management and gathering quick wins before a broader adoption. So the first 3 months, we'll be planning and designing, forming cross-functional project teams, confirming goals and outcomes, and researching solutions. For month 4 to 6, we would develop and pilot the platform, selecting vendors, customizing adherence apps, and integrating with the dashboard. Months 7 through 8 would be engaging with the patient and providers to deliver the training on the tracking tools, the personalized support, as well as improving coordination. And finally, for month 10 through 13, we're gathering data and optimization, so collecting adherence metrics, analyzing gaps, identifying the high-risk groups for intervention. And so thank you for listening to our project, and I hope that you enjoyed the presentation and will get in contact with us. Thank you.